Hello students, let's gonna do a discussion on the vertebral column, and this is the bony structure that actually protects the spinal cord that we just finished discussing in an earlier video. So you have 26 irregular bones that make up the vertebral column, and it is pretty much primarily the axial support of the trunk. And we can take a look at it, what it looks like here. Here's an anterior view of the spinal cord, and here's a lateral view of the same vertebral column. Now, there are divisions and curvatures to the vertebral column. You have cervical, you have 7 cervical vertebrae, 12 thoracics, 5 lumbar, and you have 1 sacrococcygeal region. And as far as curvatures, you have your primary curvature is going to be the area of the thoracic and the sacral parts of the vertebrae, and then you have your secondary curvatures are going to be your cervicals and lumbar. The curvatures coincide with, for example, the primary curvature coincides with your fetal position. So when you were a fetus, your vertebrae was shaped like a C. Therefore, the primary curvatures stayed as such. Okay, so if you look here, here's your primary curvature, thoracic, and here's your sacral. Notice how this has maintained a C shape, hence the term primary curvature. Secondary curvatures coincide with the fact that when you became first milestone when you were an infant was to raise your head and be able to look forward. Therefore, you develop a secondary curvature. And then your lumbar, when you became bipedal, started to walk, you develop a curvature in the lumbar region. So here's the cervical curvature and the lumbar curvature. So these are secondaries, these are primaries. The thoracic and the sacral curvature are primaries. These are some problems that can arise with the vertebral column. You have kyphosis. This is a fancy term that describes, especially in the elderly, many of them develop a hunchback-like appearance. Kyphosis. Lordosis, you see it very commonly with pregnant women, okay, or they call it swayback. And scoliosis is pretty much lateral deviation of the vertebral column. And this can cause a couple of issues where you'll have deviated shoulders. One shoulder will sit higher than the other one, or you can also have a pelvic tilt. Now, in terms of vertebral structures, you have the body. You have the vertebral, or they also call it the neural arch. That includes the lamina and pedicles. You have the vertebral foramen. That's the part that surrounds the spinal cord. You have your spinous and transverse processes. You have superior and inferior articular processes and facets. Now, these are the interlocking parts of the vertebrae. That's how they interlock with the vertebrae that sits above and below them, forming joints. And then your intervertebral foramina are the exit points for the spinal nerves. Okay, so here's a breakdown showing you here the spinous processes here. Is your transverse process, okay. Here's your lamina, right here, okay. Vertebral foramen, part that surrounds the spinal cord, protects it. Here's the body, okay. And here are your articular processes and facets. So, now that you have an understanding of this, then here's where some problems can arise with regards to newborns. You have a condition known as spina bifida cystica, where you can see here that there is pretty much absolutely no development of the lamina, And in the case of spina bifida occulta, well, this is a pictorial or diagram of the problem, and then here's the gross depiction of that. In spina bifida occulta, the newborn will have a little tuft of hair on the skin, and what you can see here is there is some development, there is evidence of a lamina, but the problem is that it did not fuse here in the midline. Okay, so there is pretty much confinement of the spinal cord within the vertebral foramen, but there is not a complete fusion of the neural arch. Okay, so in occulta there is evidence of lamina, but not fusion in the midline. In spina bifida cystica, there is literally no development of the lamina. Therefore, that creates a bulge of CSF pushing through and breaking the skin in the newborn. This is showing you a lateral perspective of the vertebral column, how they articulate. Here are the facets. Okay. Your cervical vertebrae, the typical ones, C3 to C7, they have an oval body, a short spinous process that's bifid. You see a little splice at the very top of that, and they have transverse foramina. They have openings in the transverse processes. This opening allows for the coursing of the vertebral arteries. This will come into prominence when we talk about blood supply to the brain. So your first cervical vertebrae is your atlas, second one is your axis. Atlas has no body, no spinous process, and the superior articular facets articulate with the skull. Then the second cervical vertebrae is the axis, has a body, has a spinous process, and it has a dens. They also call this the odontoid process. So here's your atlas. This is the part that articulates with the occipital condyles, right, of the skull. Allows you to say yes, or it pretty much carries the skull. Articulates with the occipital condyles. We'll revisit this part of the skull when we do the skull skull discussion, cranial discussion. And then you have your odontoid. Here's your axis. So this is your atlas, or C1, and here's your axis. C2. Here's your odontoid process, and then you can see how this will articulate with the atlas and form a pivot. Thoracic vertebrae, they increase in, and again, I'm sorry, going back to these two, and notice how you have openings in the transverse processes that allows for the coursing of the vertebral artery. Thoracic vertebrae, they become larger as you go from first to last. They have a heart-shaped body and they have a circular vertebral foramen. Then here is a diagram that illustrates how you have innervation of the joints. So notice how in the previous discussion of the formation of a spinal nerve, notice how the here's your spinal nerve, then you have your dorsal ramus, and the dorsal ramus is going to give rise to a small branch, the articular branch, and this nerve is going to innervate. It's more so for sensory information, pick up sensory information here in the articular facet. Okay, here and here. Then the again the anterior ramus. Here we go. Here's your spine, spinal nerve. Here's your dorsal ramus, ventral ramus. Here it is this spine is going to give rise to a meningeal branch of the spinal nerve, and that's going to come in contact with your intervertebral discs, okay, here, and again is for sensory innervation. And what happens is that these nerves, the articular branch and the meningeal branch of these spinal nerves, this allows an individual to perceive discomforts. Oh, so when a person is experiencing back pain, or the basis for back pain, lower back pain, upper back pain, wherever, it can perceive those discomforts via the articular branch, or if there's a slip disc or herniated disc, this can be perceived via these branches, the meningeal branch of the spinal nerve. Okay. Now, with regards to, well, let me get to the lumbar vertebrae. It has a large body. It has short laminas and pedicles. It has short and flat spinous processes. Not much to add to that. Then you have your sacrum. It's these vertebrae are fused in the adults. You have sacral foramina. These are exit points for the cauda equina. You saw that in the spinal cord video. And then you have your lateral median and lateral sacral crests, and then you have your sacral canal and hiatus. Now, let me, and then you also have a coccyx, vestigial tailbone. The coccyx is an attachment site for ligaments. To be more specific, the coccygeal ligament. Okay, we saw that ligament in the video of the spinal cord. And the sphincter muscles, and it is also a set of fused vertebrae that completes in adulthood. So here's an anterior view of the sacrum, posterior view. Now, sacral canal. This is where, here's the conus medullaris, end of the spinal cord, conus medullaris. So the cauda equina, horse's tail, mesh of nerves, goes from here, and it goes in. It enters in through the sacral canal, and then some of these nerves exit out through here. Dorsal ramus goes out through there, and you also have nerves coming out here from the front. So, in summary, the cauda equina, or that horse's tail of nerves, they enter through the sacral canal, and they exit out through the, they enter the canal, and they exit out through the foramina. Okay. Then you have the hiatus. The coccygeal ligament goes out through here, and it goes all the way down and attaches onto the coccyx. Now, it's important that you're also aware that the sacral hiatus, this part right here, is your target site for administering on a patient if you want to administer a caudal epidural. You want to administer it in this area right about here. Okay. Do not confuse that for the lumbar puncture. Okay. The lumbar puncture is obviously much higher in the vertebral column. Okay, between L3 and L4, and its intention is to collect CSF. In the caudal epidural, the idea here is to administer the drug to facilitate parturition for a expectant mother that wants to embark on a C-section. Okay, so the sacral hiatus is the target site for a caudal epidural. Ligaments and discs. So you have discs that run in the front, in the back. They run the entire length of the vertebral column. The intervertebral discs are like little shock absorbers. Okay. The inner core of that intervertebral disc, you have a pulp and an outer ring of fibrous connective tissue known as the annulus fibrosus. Now, keep in mind that the disc accounts for 25% of your height, and this will obviously diminish as you go up in age, okay? And the herniated disc is the rupturing of the annulus fibrosus. So let me show you the anatomy of a herniated disc. So here's the nucleus pulposus. If you have compression of that disc, that can actually cause the pulp to bulge out and compress on the root, therefore causing pain and resulting in a so-called pinched nerve. Okay. And folks, that concludes my discussion on the vertebral column. Thank you for watching. Goodbye. Secondary curvatures coincide with the fact that when you became first milestone when you were an infant was